I'd hoped very much this year we would meet in person, but obviously COVID is still determining how we operate, so thanks for joining us by Zoom. 2020 was the fourth year of Epilepsy Ireland's current strategic plan. It has 6 overarching aims: support and information, awareness and advocacy, training and education, research, funding and governance, each with objectives to achieve our vision of a society in which no person's life is limited by epilepsy. The emergence of COVID-19 in early 2020 had a significant impact on how we interacted with the people who needed us, in particular our community-based and group-based work. This traditionally makes up a large portion of our work annually. In line with public health restrictions, all group events and face-to-face work was suspended in March, and staff were required to work from home. Immediate priorities were to ensure that our service users were aware that telephone, mail and later virtual supports remained active and how they could be accessed. Vulnerable or isolated people with epilepsy, as well as those living alone, were prioritised during this. New technologies such as Zoom were adopted to ensure communication was maintained, and as the year progressed, online one-to-one supports, sports groups and outreach became the norm. Can I ask if anybody has their microphone on that they could mute it, please? Social media, video, website were also used to provide information and support, including on the many queries, challenges and concerns faced by people with epilepsy during the pandemic. While the cancellation of community outreach and group events resulted in a drop in the overall number of service user contacts in 2020, with 17,384, compared to 21,821 in 2019, there was a marked increase in individual one-to-one contacts with our team. In 2019, we had 9,836 contacts, whereas in 2020 we recorded 11,392 contacts through phone, email and online platforms, highlighting the importance of our community resource officers remaining available throughout the crisis. In 2020, the service team facilitated 59 information sessions, events, workshops and seminars, the majority of these online, with 1,053 people attending. These included events on employment issues, wellbeing and self-care, women in epilepsy, parents events and joint events with other organisations such as the National Learning Network and Helium Arts. Unfortunately, events such as the National Conference and the Family Fun Days were not possible in 2020. In late 2019, Epilepsy Ireland received funding of €93,000 through the Sláinte Care Integration Fund to deliver an education programme for people with a new diagnosis of epilepsy in conjunction with the HSE's Epilepsy Service. This new service was designed to be delivered in group face-to-face settings, and unfortunately it was interrupted by COVID-19, requiring a redesign of the project. Live virtual sessions were organised with HSE epilepsy specialist nurses, and the project was extended into mid-2021 to enable completion. We continually review and update our epilepsy information materials. A new resource on memory and wellbeing was developed, and a number of other resources were updated, including our information pack for education professionals, epilepsy in school, safety and seizures, epilepsy explained and epilepsy treatments. In addition, work was underway at year-end to update the Living Well with Epilepsy toolkit materials. We also began work on developing a new e-learning platform to enable longer-term structured online delivery of key self-management and information resources, while the Epilepsy Ireland app, available both on Android and iOS, was also undergoing a redevelopment, and these projects will be completed in 2021. Epilepsy Ireland organises or participates in a number of national and international events to communicate with our target audiences and raise awareness of epilepsy. International Epilepsy Day 2020 took place on February 10th, and Epilepsy Ireland's campaign focused on dispelling some of the most common myths that still surround the condition. The myth that an object should be placed in someone's mouth during a seizure, which of course we all know should not be done, or that there's only one type of seizure, or that a person should be restrained during a seizure, or that myth that everyone with epilepsy is affected by flashing lights. So taking place pre-COVID, the campaign featured 4 EI volunteers, Oliver, Debbie, Lorraine and Gerard. It's estimated that over 1 million people were reached in total through the campaign, thanks in no small part to our amazing volunteers who funded it. And it covered print and broadcast media, as well as huge posters on bus shelters and shopping centres. I'd like to put on record my thanks and that of the board and management to our outgoing board member, Tony Caravusanos. Sorry, Tony, I always pronounce your name wrong. And his team at Havas for their time, creative skills and dedication in delivering numerous campaigns for us, much of which were provided pro bono. National Epilepsy Week took place from May 18th to 24th. Epilepsy Ireland joined with our colleagues in the UK to explore the theme of more than seizures. Obviously a hashtag in front of that. This theme aimed to show that epilepsy can have an impact on different areas of life and is not simply about having just seizures. SUDEP Action Day took place on October 23rd, and a key message was to encourage people with epilepsy to learn more about this rare but devastating aspect of epilepsy and the importance of managing the modifiable risk factors. Personal testimonies from families who have lost a loved one were also highlighted. We also published data from a survey of over 300 people with epilepsy on awareness of SUDEP and communications between them and their healthcare team around this issue. The results showed that people with epilepsy want to know more about SUDEP and have open conversations with their healthcare team. In the advocacy arena, there was a major leap forward for families who've been impacted by sodium valproate epilum in Ireland, with the Minister for Health, Deputy Stephen Donnelly, announcing in November that an inquiry would be held into historical licensing and use of the commonly used epilepsy medication. Epilepsy Ireland and Oaks Ireland, which is the Organisation for Anticonvulsant Syndrome, have been campaigning on the issue for many years. The announcement was warmly welcomed by families who have been affected and who deserve answers about how this was allowed to happen. Unfortunately, little progress has been made on establishing the inquiry, and the campaign continues in 2021. We are also focusing now on the need to take further action to minimise the risks in the future and to ensure that children and families affected are appropriately supported by the state. In September, Epilepsy Ireland made their first submission to the National Centre for Pharmacoeconomics in support of the reimbursement of Epidiolex, the first CBT medication licensed for use in epilepsy. The drug is indicated for use in 2 rare severe epilepsies, Lennox-Gastaut syndrome and the Dravet syndrome. In November of 2020, we also made a submission to the Oireachtas Committee on Disability Matters, focusing on 2 key issues that affect many of our members and their families: access to free travel for people who cannot drive due to seizures, and the need for more appropriate, reasonable accommodations for students with epilepsy who are sitting state examined. We're continuing to work on these 2 important issues that affect so many people with epilepsy. Since 2009, Epilepsy Ireland have been providing a training programme in epilepsy awareness and the administration of buccal midazolam, or BM, to health and allied health professionals. The aim of the training programme is for participants to develop a greater understanding of epilepsy, understand the role of the emergency rescue medication, and receive instruction in the correct administration of buccal midazolam. The training was adapted for online delivery, and during 2020 demand remained high. 163 courses took place, as opposed to 277 in 2019. And 2,057 healthcare professionals and teachers were trained, as opposed to 2,871 in 2019. Demand remained high from educational professionals for our epilepsy awareness training for teachers, SNAs and others in education. We still delivered 129 talks in schools, preschools and other education settings, with 2,463 people attending. In 2019, we'd had 156 talks with 4,659. Training for Success, or TFS, is Epilepsy Ireland's one-year full-time QQI Level 5 training programme based inside the IT. 10 students began the 2019-2020 programme in September 2019. From March 2020, TFS was adapted for online delivery and 7 students graduated in August 2020. Due to ongoing restrictions, the 2020-2021 term was delivered online. 11 students began the course in September 2020. We're delighted that the 2020-2021 programme began this month with students back in the building. Prior to 2020, over €1 million had been invested in 13 research projects over the past decade, and in 2020, 2 new projects were funded. €15,000 was invested in a new study led by Norman Delante at Beaumont Hospital to examine the impact of imposed driving restrictions on people with epilepsy. Being unable to drive can be one of the most significant aspects of an epilepsy diagnosis, but the effect on the lives of people with epilepsy and families is not well documented. Up to 25,000 have been committed to a new study in epilepsy mortality led by Dr. Yvonne Langan at St James's Hospital in Dublin in partnership with the Health Research Board. Using data from coroner records, the study will examine all deaths in people with epilepsy in 2019. The researchers will also be able to determine the incidence of epilepsy-related deaths, with particular emphasis on cases of sudden unexpected death in epilepsy, SUDEP. This will be the first countrywide examination of SUDEP and epilepsy deaths in Ireland. It's hoped that the study will increase awareness of the issue. The board is committed to the highest standards of corporate governance and understand that this is a key obligation, not only in ensuring best practice in fulfilling the organisation's mission, but also in maintaining the trust and confidence of members, service users, volunteers and donors. 9 board meetings were held in 2020, as opposed to 7 in 2019. Responding to the challenges and risks caused by the pandemic were the board's key priorities, both the financial challenges and ensuring we maintained and adapted our services. The organisation maintains the Charities Institute Ireland's triple lock standards of compliance with the guidelines for charitable organisations and fundraising from the public, the governance code for the community and voluntary sector, and preparing our financial statements in accordance with SORP for charities. In 2020, we also began working on achieving compliance with the Improving Quality, or IQ quality standard for charities, and this was achieved earlier this year. We've also begun looking at a new strategy for the years ahead, and a review is currently underway. Some of you may well have fed into the some of you may well have fed your thoughts and ideas into that process already. We'll be launching that new strategic plan in 2022. And one of the most important things for us this year as well was our fundraising. Fundraising is vital in ensuring that our charity continues to work towards our vision, and this was severely hit in the pandemic. Paul, our treasurer, will speak about this in his report in a few minutes. But I want to put on record our gratitude to all our members, donors and supporters who responded to our appeals during what was a very difficult and uncertain year for everyone. While the restriction meant that you've been unable to support us in the traditional way, you certainly have been more than willing to think of new socially distant ideas and challenges to support the work of Epilepsy Ireland. We are also very grateful for the support of Expert Electrical, who selected Epilepsy Ireland as their charity partner for 2020 and 2021. Despite the ongoing challenges, we remain focused on delivering for everyone who needs us, but funding is always a challenge. So once again, I'm rattling the digital bucket and asking you and yours to support our fundraising efforts like Rose Week, which is coming up very soon. You can do it all online. It does not have to raise a lot. Every cent counts. This is your organisation and it needs your help. So please, if you can, and thank you for, as always, for your ongoing support. Finally, I'd like to thank our CEO, Peter Murphy, for his leadership and hard work during a very difficult year. I would also like to put on record the board's huge gratitude to all the staff team for their flexibility and dedication to work in changed circumstances. I'd like to thank my fellow board members who were available regularly, both as a full board and individually, to help navigate the journey that was 2020. While we are still some way from returning to normal, remember that one thing remains certain: we are still here for you. We are focused on achieving a society where no person's life is limited by epilepsy. Thank you.